Hi all, good morning. Hope you're having a fantastic Friday. This is Abdesh Saxena here. I'm your host and moderator for this event. I'm part of Aetna, a CVS health company, and I'm uh, very much active in the startup uh, scene in Hartford. Also part of innovation committee in Aetna. So today we are going to discuss on topic unmet needs, opportunities in MedTech. And to discuss this, we have Stephen Graff with us. He's from Cigna. He works as a product manager there. Welcome, Stephen. Do you want to introduce yourself to our audience?
Hi. Yeah, sure. Hi, everyone. Stephen Graff, like Avdesh said, with product management and innovation. So I think at the end of the talk today, we'll talk a little bit about who to go to in healthcare when you have an idea. And I'll talk a little bit about my role in innovation and innovation roles kind of across the board in the health tech area and who to talk to in those areas.
Thank you, Stephen. So as we go along, if you have any question you want me to ask Stephen, please feel free to share those questions in your Hopin chat, and I'll try to ask them during the end of our session. Also, we will be interested to know what are some of the medtech devices you use in your daily routine, or you might be aware of, or you want to share with us. So please feel free to drop a comment about that as well. So now getting started. So Steven, uh, for our audience who are not very familiar with this uh, topic, kind of medtech or medical technology, would you mind explaining them or defining it? What does medtech mean?
Yeah, sure. So I think MedTech it is a very, very broad term, right? And it covers all different types of medical technologies. I think two kind of big buckets that we can think about. One, you have sick care, right? Which is probably what comes to mind first when we think about all the healthcare that we see going on in the hospital, right? So once someone's already sick, then they go to the doctor's office or they go to the ER. And then we see a lot of medical technology in the hospital helping people recover from sickness. On the other side, we also have healthcare, right, or preventative healthcare rather, that is about keeping people healthy. And so from an insurer perspective, we want to focus much more on the healthcare, the preventative healthcare side, as well as the sick care, right? So those are the two kind of broad categories. For some examples, I think in sick care, right, we think of things like imaging, medical imaging, procedures, medical technologies and devices that help with those procedures, orthopedics, things like that. When we think about healthcare, again, it's more about wellness solutions, recovery. How do we get someone up and running faster after a surgery or something like that? And then also focus on value-based care. How do we make sure that someone's overall health is being attended to, and how do we make sure that when they are getting care, that they're getting the best care possible? So those are kind of the two broad buckets. That the way I think about it is the sick care versus preventative health care, and all the medical technologies that help assist in both of those fields. The other piece is also from a technology perspective. We have things like software and hardware, right? So again, medical devices, that's much more on the hardware side. Now, even in the preventative health side, we're coming up with hardware, things like Fitbits or Apple Watches, trackers that are monitoring your health. But on the software side, we're seeing a lot too, right? Digital coaching, a lot of data analytics for recommendations, referrals, things like that. And then in its own kind of bucket category, we have things like genomics, right? Looking at things like personal genomics. I'm sure there's some people here that have used something like 23andMe or Ancestry.com. We look at pharmacogenomics, right? Looking at kind of drug interactions depending on your genome. And then AI and genomics, right? What are we doing today with artificial intelligence and the genome? So a lot of different ways to think about MedTech, a lot of different fields that are incorporated into that term. But I guess that's a quick high level summary of it.
No, thank you. That was very helpful. So basically, in a nutshell, medical or MedTech refers to all the medical products or services which you may be using to treat different medical conditions and diseases in wide ranges of areas, as you mentioned, diagnosis, sick care, uh, wellness, and all those things. So thank you for that. Now, Hartford is kind of known as a world capital of insurance. We have large number of insurance companies here. InsurTech is booming. So how do you think InsurTech and MedTech are related or connected with each other?
Yeah, I think as an insurer, we see a lot of kind of intersection between the two. If you think about, we touched on sick care, right? Being in the hospital setting. Sick care in general is much more expensive to care for, right, than preventative health, right? And so there's an incentive for healthcare companies and insurers specifically to keep people healthy, because the more healthy people are, the less that they're ending up in the emergency rooms or urgent care centers. And so the more costs that are saved, right? And so there's a lot of alignment around keeping people healthy, right? And then if we think about value-based care, that's another area of intersection, right? Where it's not just about keeping people healthy, but if something does happen and someone does get sick, how does an insurer make sure that someone's getting the most value out of their care possible, right? So how do we provide, using our analytics, recommendations to physicians or hospital groups that we know are most efficient and kind of quality-wise good for our customers, so that they're able to get the procedure that they need and come out and recover as fast as possible. So it's a little bit of both. It's how do we enforce the preventative health side, right, to lower costs, and then when something does happen, how does an insurer help make sure that the patient is getting the right care that they need? So there's a lot of intersection between the two, and insurance companies use a lot of medical technology to make sure that people are being healthy, staying healthy, and that when they are getting care, that they're getting the right care that they need.
No, that's true. And I definitely agree with you. Insurance companies are spending a lot of money in making sure that their members are healthy, as you mentioned. Plus, if something happens to them, how can they recover faster? How can you come out of ER or a hospital admission? And once you are at home, how can you get a better care through some of these medical devices and the technology which we are getting. So moving ahead, what are some of the examples of MedTech products which you have seen? We may be using it on a day-to-day basis, or we see at hospitals or doctor office and things like that.
Yeah, there's, so many, especially as a product manager, we see so many different tools being used for both that preventative side and the sick care side. I think some of the interesting examples from technologies, right, is we can think about kind of this wave of monitoring tools, right? So Fitbits, Apple Watches, Garmin's, and those first coming in mainly as measuring your steps and activity, right? Now we're seeing that they're getting a little more technically advanced, right? We're able to look at things like ECGs now. There's progress on some of the newer models that are even looking at mental health states, right? Looking at stress and stress management based on things of like how you sleep and monitoring how alert you are throughout the day. So we're getting more and more into this continuous monitoring, all with the idea that it helps people better understand their health and then also focus on improving it over time. So that's one really interesting space that we see growing, and that we're using today. We've had things like fitness challenges in the past where people compete, right, to get more steps and compete in groups, and trying to kind of gamify health in a way, which is really an exciting area as well. We also, when we think about health and wellness today, there's a lot of wellness apps, right? Incentives, goals for all sorts of wellness. So also, if we think about meditation apps today, right? Managing your mental health is becoming a big area as well that we're focusing on, making sure that people are, like I said, with the physical health, aware of it, and then also doing what they can to become more resilient throughout the day and things like that. And then another big area that we'll focus on, that there's a lot of I'd say growth, but also just excitement, and is in the chronic condition management space, right? So I'm sure a lot of us have heard of the big kind of diabetes management companies out there, Livongo, Omada, looking for monitoring and managing chronic conditions like diabetes. In that case, we're seeing startups come out for asthma. So Propeller Health is a good example, monitoring the way you adhere to your medication, but also giving you feedback based on the where you are in your behavior, how you can improve. Looking at autoimmune diseases, there's companies out there like Miming that's tracking, again, in the chronic condition space, using data analytics to track how you behave on a day-to-day basis and how that might impact your flare-ups from an autoimmune disease. So we're really seeing things all over. Telehealth has obviously been a thing for a while now, but with COVID recently, that's been used much more than it ever has been. So those are a few examples. I think we'll probably get into some more later on, but there's a lot going on. And now I think even with COVID, it's kind of pushed everything even faster forward.
Sure. And talking about telehealth, we have a question from our audience. So what role do telehealth platforms, both asynchronous and synchronous care, play in the unmet needs, opportunities in MedTech, particularly those platforms that serve underserved communities? So do you want to talk about a little bit more?
Yeah. So, I mean, I think it's a good question. I'm glad that we broke out asynchronous and synchronous care. I mean, telehealth, especially today, in the time of COVID, is a huge tool that's being used way more. I don't have the numbers on me, but it's probably like tenfold the amount that it was in prior years. And I think part of this question talks a little bit about accessibility to care, right? And in underserved communities, I think that's always been a big issue is not having the access to the right care, right? And so today with some of and I guess we can take kind of telehealth on a broader level, right? We can think not just talking directly to a doctor, but also using new tools like diagnosis, artificial intelligence diagnosis tools like Buoy Health or Babylon Health, making that easier. But then also, when the recommendation does come through to talk to a physician, utilizing telehealth to improve the accessibility for some of those folks in underserved communities. So I think accessibility is a big piece of it. And I think that, with COVID now, it's just been accelerated even more. I think I answered a little bit. I don't know if there's a follow-up there. Yeah.
No, that's a good point. And definitely, as we see, right, like different expertise is available at different locations. So sometimes if you're living in a place which is far off from your regular doctor office, and I know it happens in some of the plans where your nearest doctor is, say, 50 miles away or something like that, then definitely, telehealth help you in connecting with not only the nearest, but the best doctor and get the best facility for your issue. Now,
I'd also just add, now that we're talking about it, from a cost perspective, right? That's kind of a big factor too. A telehealth call is I think almost always less expensive from with or without insurance even for patients, right? So lowering the cost, again, that's going to open up accessibility for a lot of people as well. So I think there's definitely numerous benefits to it, and what we're seeing now with the use of telehealth being much more ubiquitous.
Sure. And on a personal note, I am kind of using telehealth since I got married, because both my in-laws are doctors. So whenever I have an issue or some issue with family, we'll call them up and, ask what to do, and sometimes even get a over-the-counter medicine. So I mean,
Yeah.
that's exciting. That's now everyone can access, the same thing. And talking about devices, right? Like I was listening to one podcast yesterday, and they talked about a monitor, which is like a glucose monitor or something, which monitors your glucose or sugar on a real time basis, and it tells you when you eat something how much it is impacting you, so that you can make a better choices and be healthy. So I mean, uh, and there are thousands, like more than I think 20-30,000 people who are in line to get that device. So it looks like people are really
Wow.
excited about innovative medtech products if you are able to solve a real business problem.
Mm-hmm.
um, Now there's one more question, but let's go to our next topic, and then we can cover this question. Um So our next topic is related to what are some of the areas of growth and current trends which you see currently in medtech area. And the question which we have received from audience is, what examples can you give where insurance payer work with the provider for preventative health? So maybe both of them kind of tie together.
Yeah. Yeah, I think actually part of it can relate to what you were just talking about with the blood glucose monitor, right? I think when we think about preventative health, you have these insurance companies that have kind of built out some pretty rigorous programs to help monitor, I guess you can call them patients or customers, with some of these chronic conditions. So if we take, for example, diabetes, looking at blood glucose levels, I think that's a great example, right, of an insurance company providing a program to help monitor blood glucose and overall diabetes as a condition, and then working with providers on that front. So obviously when something were to happen, or if it does happen and they go to a provider, then they'll know about the program that the insurance company has enrolled the customer in. And so helping monitor those chronic conditions, I think that's an example of the preventative care, right? Also, we think about, on a similar note, quick recovery, right? So working with making sure that patients recover from surgeries or illnesses quickly, and working with providers to make sure that happens. I know that there's also, actually going back to a little bit the remote monitor or the telehealth question, we also see programs coming in for things like virtual physical therapy, right? That's a way where insurance companies are kind of almost partnering with physical therapists to make sure that patients are recovering faster at home, and making the accessibility better. And when I think about preventative health, I'm also thinking about wellness programs, right? Fitbit, Apple Watch, making sure people are active. I think we're starting to get to a point where some of that information is able to be shared back with kind of PCPs or other kind of providers that might be helping the patients out. So we're starting to get there. I think it's not perfect. I think it's probably an area where there's definitely an opportunity for growth, is kind of the, I guess you could call it, interoperability of some of the healthcare data and the monitoring that goes on between the insurer and the provider. But there's some examples out there. I think there's much more opportunity there as well. And then going back, I think you asked the question about the growth in the MedTech space. I usually, so from my lens, I think about it from a technology level, right? What are some of the biggest technologies in the space? We touched on genomics before, and I'm definitely not an expert on on those, but the space is growing, and it's exciting to see what's going on, especially in using artificial intelligence with genomics and identifying also the kind of the pharmacogenomics with the drug and genomic kind of interactions there. Other technologies that I think about that are really growing in the space is one, you can think virtual reality, right? So I think we started seeing it in the beginning mainly for things like medical training, right, in medical schools, looking at operations, and it's really expanded far beyond that. Now we're seeing it. We used a company called VR Health in the past, which is using virtual reality for physical therapy, right, for spinal injuries, being able to stretch in certain ways, playing games in the headset, but games that are actually making you stretch and tracking your progress over time. We're also seeing virtual reality in the pain management space, right? So specifically with burn victims, for example, we'll see for acute pain, at least, people that are wearing the goggles actually seeing far greater alleviation of pain compared to some of the strongest pain medications. And so we're really seeing some of these applications come forth, and I think there's a lot more progress to go, especially as the technology in the virtual reality space increases. Another technology, blockchain, right? I think we've heard it a lot. This is probably the most kind of in the most infancy of all the technologies kind of going on, but what we do see there is with EHRs, right, and interoperability, an opportunity there for people to have kind of their own personal health records, distributing it and giving it to providers or other users, insurers, whoever it might be, kind of in the healthcare space using blockchain technology. Startups like SolveDocCare are doing a lot of work there. And then even in the health and wellness space, I think there was a Sweatcoin that we looked at for a little bit that was doing something to keep people active using blockchain technology. And then artificial intelligence, machine learning, this is really the biggest space. If I think about growth areas in MedTech, this also has probably some of the biggest opportunity, right? If we think about what's going on with data and artificial intelligence, diagnosis, things like using smart home, like the Alexa, the Google Home, looking at medication reminders, or even at this point, looking at tracking kind of or monitoring your health through these platforms that you already have in your home, looking at medication, dosing or appointment making, even matching patients up with the right provider, right? So we're seeing tools come out that are matching you based on your conditions, your demographic, with providers that might be working effectively with people like you. And then kind of the last space being IoT, right? Sensor data. We talked about the Fitbit, Apple Watch, other devices out there. So combining that with the artificial intelligence, we're really going ahead with the monitoring as well.
Sure. Thanks for sharing that. And few points to add to it. One more trend which we are seeing is 3D printing. So that can be used to create implants or things like that, which are very specific to a patient from MedTech perspective. Other, you already touched AI, and AI for diagnosis, based on the past data which you have, and maybe if multiple insurers or hospitals share it among themselves, then based on the symptoms you can quickly predict what could be the issue. And I think voice is also becoming big with Alexa, Google Voice, and all these coming up. You can use it to schedule online appointments, call in for scripts, and all those things. Even there is an app which you can use to find out how much dosage of a medicine you should be taking. So just to add a few more things.
And also, just on that note, when it's talking about voice, right? So we're seeing not just using voice to interact with your health, right? Talking about taking medications, but it's also becoming a tool for diagnosis, right? Especially in the mental health space. We're seeing algorithms come out that are looking at people's mental health and mental states based on the way they speak and their voice. And so it's not currently embedded into tools like Alexa and Google Home, but I don't think we're far off either. If you look at companies like Ellipsis Health, they look at just, a 2-minute sentence of you speaking, and they're able to, they call it a vital. They're able to detect, how much your stress level, your anxiety level, and things like that. So I think voice is a big area in that sense as well, the diagnosis sense, as well as just interacting with your healthcare.
Sure. And we have one more question, and in fact, a comment as well. So one of our audience is saying that, as a type 1 diabetic, I can say hands down that Dexcom continuous glucose monitor paired with Apple Watch is a game changer. As those in the community kid, you go from surviving to a thriving. So for, them, people are sort of, many times we see people are dragged into using tech for medical wellness, but in this case, benefits are apparent. And then there's on the other side where you have elite athletes who are always looking for optimal performance, and they're using to adapt new tech. So the question is like, what's the industry doing to get the rest of the people involved, right? So okay, so I think what they're saying is on one side you have people who are really, having challenges like diabetes and all, and on the other side you have elite athletes. But what about people in between?
Right.
How is the industry involving them?
Yeah, I think it's a really good question. And so as a product manager, that's a question that we ask ourselves a lot. I think I would start off by saying a lot of it comes down to the kind of the customer experience at the end of the day. We talk a lot about how do we gamify health, right? How do we make it part of your everyday life, so that it's not something that you just think about when you go to the doctor, but something that you think about to go on a run after work, or stay healthy, mental health, right? Focusing on building up resilience and things like that. And so I think slowly more and more people are just naturally getting involved as some of these consumer wearables like Fitbit and Apple Watch become more ubiquitous. But also, I think part of it is the job of the health companies to make some of these wellness solutions more gamified in a way, making it more engaging. I think that's, I know the title of this is called Unmet Needs. I would say that's probably one of them, is making some of these tools more engaging and getting people involved with their health in a way that they want to be. So I don't think we're there yet, but I think there's a lot of progress to be done in that space a little bit. I know as new solutions come out, and now maybe there's, as some of the newer consumer wearables focus more on mental health, that might bring in another group of individuals too that are more frequent users of technologies like Fitbits and Apple Watches.
True. And adding to it, right, like when we talk about what is industry doing to get people involved, at least I see for my insurance, like, we get an Apple Watch, and you pay for the Apple Watch through your activity over a period of time. So it is kind of incentivizing you to be fit and active, and kind of get it for free, and include people across the board. And similar incentives are coming. We see, as a incentive in your deductible, or payment for doing those activities and those kind of things. Now going ahead, like just on a personal note, right? What are some of the MedTech devices which you may be using, or you have interacted with recently?
Yeah. So I've used a few, at least over the last year and a half, 2 years, especially just from a product perspective, understanding what the devices do out there. I'd say the Aura Ring is one that I thought was really interesting from a sleep tracking perspective. That's actually a space we haven't talked about today, but sleep is a major kind of area of focus. If we think about whole person health, and both the mental and physical kind of depend on good sleep. And so sleep tracking, I think, is something that's becoming more and more popular as well. And the Aura Ring is one tool that I've used. It's a little challenging because it is something you have to think about. You have to say, okay, I want to put this on before going to sleep. There's others coming out like smart pillows or mats for sleep tracking as well. But I'd say the Aura Ring, and then also the Garmin. I have a Garmin watch that I'll wear occasionally for like exercise and tracking like that. But it's also interesting to see some of the new features come out with stress management there as well, and actually feeding some programs with mental health and breathing exercises all built right into the watch for you.
Sure. No, thanks. And yeah, you talked about sleeping and all, and I think meditation is something which is helping a lot in this area. And I'm also trying to use some of these meditation apps, um, and I think they help a lot. And even from the medtech perspective, if you look, and you, as you already mentioned, like, behavioral health and uh, pain management, and a lot of those benefits are also tied up with meditation.
Mm-hmm.
So going ahead, as you know, like, COVID has impacted all of us, from small business to large communities. It has impacted education industry, where, our kids are doing distance learning. Everyone is adapting to it. Food industry is impacted. We're not able to go to restaurants, like, ordering out, and so many industries. So how has COVID changed the medtech industry or a landscape? And what are some of the maybe new innovations coming in this area?
Yeah, I think we talked a little bit about telehealth, right, before, how much it's grown because of COVID. I think that's probably one of the most obvious and greatest impacts is that switch from, if I don't have to go in to the doctor, then doing a telehealth call is just as good, if not better. And so telehealth is obviously one space, as well as digital coaching becoming much bigger. So digital coaching can be more than just coaching you through either a chronic condition or coaching you in a physical sense, getting you like well-being wise, but also from a mental health state. I think COVID's done. I think if you look at the numbers, there have been a few studies published that show that COVID has significantly made a lot of the mental health stress levels worse, right? Or anxiety, depression, things like that have increased since the start of COVID. And now we're looking at tools like digital coaching that are able to try and help those in need. I think from not so much a medical technology perspective, but from just a medical perspective, we're seeing a lot of needs coming out from mental health, and so that it was already a growing space, and now with COVID, it's even more so an area of focus, and tools like digital coaching are helping solve that. Continuous monitoring, same thing, right? We're now monitoring patients at home more so than in the past, where maybe they would have stayed in the hospital for a few days longer. Looking at things like self-diagnosis kits, I think that's kind of growing. At least there's a lot of attention on it now. And then I'm sure we've all heard of the contact tracing. That's in a way that there's some medical technology. You can think about that in the medical technology bucket as well. Being responsible and for understanding kind of who you came in contact with, and the algorithms that are going into that to identify potential risks.
True. Thank you. Thanks for that. And I think we have covered most of it, like, unmet needs in medtech area. But do you want to specify anything additional, or stress on some things, or the gaps in medtech space which can be addressed, or which maybe we have not discussed till now?
Yeah, I mean, I think one of the biggest ones we talked about was engagement, right? How do we get people engaged? So I know we talked a little bit about the programs out there. There's a lot of these chronic condition programs, health and wellness tracks and programs that you can do. But with all that out there, the engagement rates are still pretty low, right? And so I think in terms of unmet needs, understanding how we can get people more engaged with their health is still a major need and something that we're working to improve. You have some areas that you'll hear about consistently. Fraud has been an issue for a long time, so we're still working on fraud detection, looking at healthcare waste, right? I think something like 40% of ER visits aren't necessary or something like that. That's still a very high number. And there's a lot of work that's been done to lower that number, but I think there's still a good amount of waste. And so tackling that as well. I think it might even be a couple companies that are in Hartford that are looking at, I think predictive health might be one of them, is looking at ways of reducing the waste in the healthcare space. We can think about, just process improvement overall. I think it's something that you've mentioned in the past is there's still some issues with interoperability, right? I know that there's some big changes coming that even have been done recently, but making sure that everyone has the right information at the right time from a healthcare kind of architecture process. There's still some gaps that need to be met there. And then, I think there's just still some specific. There's many specific either disease states or medical issues that we're tackling, and so we can think of addiction, drug overdoses. That's still something that one of the areas that we're focused on trying to solve, and as well as some of these other more specialty states, musculoskeletal diseases, and more.
Sure. No, that's a great point, and I'd like to stress on some of the points which you mentioned. I think one big one is the diagnosis part of it. As you mentioned, self-diagnostic kits today for a lot of different things they are available, and I think similar thing should come for COVID also, or maybe it's there. I don't know, but instead of going to some place to get it tested, why not get a kit yourself and test it? And drug overdose, definitely that's a big epidemic, and a lot of medtech based solutions are coming, but yes, maybe adaption or finding out which one is the right product, whether it's dispensing pills through a IoT device, or what kind of behavioral or whatever is the solution. But I think those are the big ones. So we have a lot of startups, as our audience, and they would like to collaborate and help in solving some of these unmet needs in medtech space. So can you suggest them how can they off the ground in bringing their ideas to life? What can they do next to collaborate, maybe with insurance companies or medical device manufacturer, hospitals, providers, whatever may the case?
Mm-hmm. Yeah, I think it's important just to talk to as many people as possible, and I'll obviously be able to give a great answer from an insurance lens, but it's also important to talk to other people in other areas that are going to have a different perspective, and also a different kind of, or at least more contacts to talk to. But it's always important to talk to as many people as possible. Whoever would be involved, you should get some kind of perspective on that side. From an insurance perspective, I think it's really important that that teams come with not necessarily a proposal, but some ideas around here's how a partnership could work. So sometimes we'll also get questions on, how could insurance play a part in this? And so as a product manager, we bounce around ideas all the time and talk to other teams across internally. And sometimes also living in the innovation space, I think it's always important for a startup to reach out to those people in the insurance companies or the payers that are in that kind of innovation chair, because a lot of the work that they do is try and bring innovative tools into the company, right? And so if a startup is coming to them with a proposition to say, here's an unmet need, here's how we're tackling it, here's how we're better than the competition, then that's an easy sell for someone internal to the company, for someone in the innovation team to say, do some research and identify, this is a really interesting solution to a challenge that we're currently facing and fits in alignment with our strategy roadmap. Let's see if we can run a proof of concept, right? And so I think if we think about like a startup working with an insurer, that's something to think about, is the kind of the pilot process, the proof of concept, building out what does that look like? How do we prove that there's value for the insurer to take on this startup and to work with them to kind of improve either the customer experience, the health, or the outcomes for their customers and patients. I know some insurers, like I know Cigna has a medical group, so you can potentially reach people through that, but also just doing your own kind of reach outs to other hospital groups, other physicians, I think is really important. Talk to the end users, of course, join events like this. But and obviously, if anyone does have any specific questions, you can always reach me afterwards as well. But it is also good to have kind of expectations set, right? When you go into a conversation with an insurer, things don't usually happen within the next 2 weeks. It could be maybe 2 months, 3, 6 months out before stuff really starts moving forward. And there's a lot of kind of upfront work to be done. But it's always good to have those conversations and understand what could a proof of concept or pilot program really look like to prove out my value in this space.
Sure. And I've received a few more questions. So one question is related to any advice or guidance for a medtech startup that is hoping to relocate to Hartford. And maybe I can provide some pointers first. So in Hartford, we have a lot of, organizations helping Hartford community. One of them is InsurTech Hartford, shout out to Stacy Brown and Nathan and their team. They have a lot of events. Definitely you can participate in that. Reset is also one organization which is helping startup community here. Launch Hartford is also doing a great work. And they are closely working with a lot of insurance carriers, at least Aetna, we work closely with them and see a lot of startups through them. So do you want to add? Yeah, Techstar, definitely one of the organization. They are organizing events like this, plus they have accelerators. Not only at Hartford, across the globe. Do you want to add something, Steve, to this?
Yeah, I think you nailed it. There's a lot of, I would say, be engaged with the community, find the people, find the right people, and then it's a fairly close-knit community. I know we've met multiple times, I think now, at different events. It's a small community, so it's easy to be in touch with the right people. So I would just really try and get involved with the events. You mentioned some names there, that would be really interesting kind of contacts to have that can also point you in the right direction to the right people. So I would say advice for someone looking to relocate, maybe start making those contacts early. I'm sure you can reach out to either of us and we'll put you in touch with some really important or interesting people in Hartford that can get you even more contacts in this space and get you talking to others in the community.
Sure, yeah, and two more things which I forgot. Nasuri, they also have a great incubator. They also provide you space and all, so they are good resource. Plus, Upward Hartford is here, where you see a lot of startups getting relocated in insurance space. And definitely, you can connect with me or Steve if you want some kind of introductions. Another question, Steve, specifically for you. What are you working on that gets you most excited? Coolest products you are seeing and hoping take flight? I think you already touched some of it, but if you can add to it.
No, it's a great question. I think so. Right now, I'm always bouncing around to different kind of spaces, but right now there's a big focus or at least what I'm working on is in the mental health space, utilizing trackers, right, that are looking at your physiological signs of stress, things like increased heart rate, reduced heart rate variability, looking at physical signs of stress and tying that to your mental health. And so we're seeing some really impressive technology out there, using technologies like ultra wideband radio waves. So you could think about it looks like a wireless router, an internet router that you could put up in your home somewhere, but then that little monitor on the wall is actually able to, using radio waves, to detect your vital signs, without even touching you. And so we're looking at really interesting new ways of monitoring health, ways that make it much less intrusive than it's been in the past, and then using data and analytics to identify recommendations and suggestions to improve that health. And so we're kind of almost looking forward to the future, into this kind of smart home where really everything you interact with is constantly helping you kind of improve your health and lifestyle in the right direction. There's a little bit of, it could be a little scary at sometimes thinking about it, but at the same time, I think if we focus on the positives, then it's definitely something that could be really beneficial to a lot of people in monitoring your health without it having to be intrusive into your everyday life.
Sure. Thanks. One more question. It's a little bit related to regulation. And if you're not able to answer, maybe we'll follow up to provide answer after this session.
Mm-hmm.
But the question is related to any thoughts on potentially changing landscape of laws that govern which provider can provide care in specific states. Currently, things are limited. You can only see a doctor license in the state where you live. Any thoughts on that potentially changing as telehealth becomes more and more common nationwide?
It's a great question. And yeah, I don't have a direct answer for it. I could see, I understand why the regulation is there at the moment, right? Different states have different criteria. But at the same time, as an insurer, right, we think about providing the best health possible, or the best health care for our customers. And so I could see that meaning opening up kind of those kind of statewide barriers. I mean, if we think about other technologies out there, you can use, for example, Babylon Health or Buoy Health, which are AI-backed diagnosis tools, right? So it's almost like going and walking into a doctor's office and answering questions, and then based on your answers to those questions, recommended diagnosis will pop up and say, here's what you should do next. So we're seeing kind of from that angle, we're seeing those kind of startups covering all states, right? And so as we get closer to the physician, maybe those barriers will start to break down. But I don't have a direct view exactly on what's going to happen in the next few years, but I could see that definitely being an interesting area, and especially as we focus on quality of health, that's something that could be in play.
Thank you. So I think those are great points. So Stephen, how can people connect with you after this session? What's the best way to reach you?
Yeah. I mean, I can provide my contact information, stephen.graff@cigna.com. It's probably the easiest email address. And also I'm on LinkedIn. I don't know, Stephen, who's running the event here, might be able to share out some of that out as well afterwards.
Thank you. And for me as well, I've shared my email, and you can connect me over LinkedIn, Avdesh Saxena. The LinkedIn profile for, I think, both of us are mentioned in the event details as well. So you can use that. So thanks, Stephen, for your time. It was a great session. At least I learned a lot, and I'm sure our audience was able to get a lot of value out of the session. And I understand that, there'll be a recording which will be created after some time, and, it will be shared. So if somebody has missed it, you can share that recording with them. So thanks everyone for your time, and have a nice rest of the day. Okay. Bye-bye.
Great. Bye. Thanks.